Well, the days of having to wear a mask on planes and airports and on public transportation is expected to come to an end when the federal mandate expires April 18th. And it'll be a welcome relief for people that have been dealing with mask mandates since the COVID-19 pandemic began 2 years ago. But Indiana Attorney General Todd Rokita joined 19 other state attorney generals in suing the federal government. They want the mask mandate ended immediately and the government barred from ever issuing a mask mandate in the future. We're joined now by Dr. Michael Weiner, a Regenstrief Research Institute scientist. He's co-authored a paper that uses evidence-based criteria to guide when masks should be required indoors. Welcome to the show, Doctor.
Thank you.
So your paper proposes 5 criteria that the government should use before declaring indoor mask mandate. Can you just briefly guide us through that criteria?
Sure. Our 5 criteria are the following. The first is contagiousness, which is the number of people to whom one person can transmit the infection. The second is vulnerability of our communities to infection. This is the growth in the percentage of the population that's infected. Number 3 is harm caused by the disease, and this is the cumulative number of deaths per week. Number 4 is the direction of harm, which is the change in that number of deaths. And number 5 is the severity of harm, which is the infection fatality ratio, or the proportion of deaths among all infected individuals.
So how does your criteria differ from the data that the CDC uses to make its masking decisions?
We see 2 main differences between our criteria and the CDC's. The first is that while the CDC's criteria focus heavily on the inpatient hospital setting, our criteria focus more on communities where people can actually transmit the infection or acquire the disease without being hospitalized. Second, whereas the CDC focuses on cases of disease, we focus on cases as well as deaths, including changes to deaths. And we think that including deaths in decision-making like this is very important.
Mm-hmm. Now, mask mandates have been all over the board throughout the pandemic. Why is it important to have a standard system like this?
Well, we think that protecting our communities is critical, but the approaches to protection currently have been largely arbitrary and sometimes even seem to be random. Sometimes this can sort of seed anti-masking sentiment. And we believe that a more rigorous approach could actually enhance the predictability of masking requirements, also so that we can know when to relax those requirements. So adding this kind of structure could actually make for a more coherent discussion and help us resolve trade-offs between individual protection and community protection.
So you use the flu season as a point of reference for your study. Why is that a good baseline?
Influenza is a pretty good baseline or benchmark for a pandemic because it's been around for such a long time, but also because our communities have developed a sense of comfort with the protections that they put into place to prevent a condition like influenza. So this can help us create some benchmark or baseline for thresholds for masking that may actually be useful. Of course, masking hasn't been very common in the United States to prevent influenza, but SARS-CoV-2, which causes COVID-19, has an infection fatality ratio that's about 10 times higher than that of influenza.
Doctor, we're out of time. Thank you so much. Appreciate it.
Thank you.